Hello guys, in this part I want to talk about the female reproductive cycle. During the female reproductive years, non-pregnant female can normally exhibit some cyclical changes in their ovaries and uterus. Each cycle takes about a month and involves oogenesis and preparation of the uterus to receive a fertilized ovum. Hormones which are secreted by hypothalamus, anterior pituitary, and ovaries, which I will show you in the next slide, can control the main events. The ovarian cycle is a series of events in the ovaries that occur during and after the maturation of the oocyte. Estrogen hormones released by the ovaries can control the uterine cycle or menstrual cycle. The uterine cycle involves changes in the endometrium, which prepare the endometrium for implantation and development of the embryo. If fertilization doesn't occur, ovarian hormone decline. This causes the stratum functionalis of the endometrium to slough off, and the general term which we use for female reproductive cycle can show all the events which happen in the ovary and in the uterus, all the hormonal changes and their regulation, and also the changes which we have in the breast and in the cervix. The gonadotropin-releasing hormone or GnRH secreted by hypothalamus can control the ovarian and the uterine cycle. In this picture, you can see the GnRH, which is secreted from the hypothalamus. It comes down from the infundibulum, enter the anterior pituitary gland, sit on the gonadotrope cells, and push these cells to make FSH and LH. The FSH or follicle stimulating hormone can stimulate the initial development of ovarian follicle, as you see in this picture. In addition, both FSH and LH stimulate the ovarian follicle to secrete estrogen. LH stimulates the takeoff follicular cell to produce androgen, and FSH can cause the granulosa cells to convert the androgen to estrogen. At mid-cycle, LH can trigger ovulation, and then it can promote formation of corpus luteum. The reason for the name of luteinizing hormone or the LH. Stimulated by LH, the corpus luteum produce and secrete estrogen, progesterone, relaxin, and inhibin. We have different types of estrogen, which is about 6 types of estrogen in the female. And the important one is the estradiol. The estrogen has different effects. One of them is promotion of the development and maintenance of the female reproductive structure, secondary sexual characteristic, and the breast. The secondary sex characteristics include distribution of adipose tissue in the breast, abdomen, mons pubis and hip, voice pitch, a broad pelvis, and pattern of hair growth on the head and on the body. It can work with human growth hormone to increase protein anabolism, including the building of a strong bone. After the menopause, you see that we have osteoporosis and osteomalacia in female, and it's due to decrease or no estrogen synthesis. And the estrogen can help lower blood cholesterol level, which is probably the reason that women under age 50 have much lower risk of coronary artery disease than do men in these ages. The next hormone is called progesterone. The progesterone is secreted by the corpus luteum. It helps the estrogen to prepare and maintain the endometrium for implantation of the fertilized ovum and prepare the mammary gland for milk secretion. We have the small amount of relaxin which is produced by the corpus luteum during each monthly cycle. It can do relaxation of the uterus by inhibiting contraction of the myometrium. Implantation of the fertilized ovum occurs more readily in a quiet, relaxed uterus. During pregnancy, the placenta produces much more relaxin and it continues to relax uterine smooth muscle. At the end of pregnancy, relaxin also increases the flexibility of pubic symphysis, and it can help dilation of the uterine cervix and help delivery of the baby. These three hormones provide feedback for the female reproductive cycle. Moderate blood level of estrogen inhibit both the release of GnRH, as you see here, and secretion of LH and FSH by anterior pituitary gland. High level of progesterone inhibits secretion of GnRH and LH, and besides all of them, we have secretion of inhibin, which inhibits secretion of FSH, and to a lesser extent, secretion of LH. The inhibin is secreted by growing follicle and also by the corpus luteum. In the female reproductive cycle, which lasts about 24 to 36 days, we have 4 different phases. One of them is menstrual phase, the other one is periovulatory, after that we have ovulation, and the next one is postovulatory phase. In this picture, you can see the hypothalamus, the pituitary gland, and the ovarian cycle, and also the uterine cycle. First, I want to talk about the ovarian cycle, and after that, I will talk about the uterine cycle. Look at the terms which we have here: menstrual phase, periovulatory phase, ovulation, and post-ovulatory phase. In the ovaries, in the first 14 days, which we call it follicular phase, we have growth of ovarian follicle. Follicular phase of the ovary is the menstrual phase and periovulatory phase together. And now I want to talk about this phase. Under the influence of FSH, several primordial follicles develop into the primary follicle, and some of these primary follicles can change to secondary follicle. Some of these secondary follicles in the ovaries begin to secrete estrogen and inhibin. By about day 6, a single secondary follicle in one of the 2 ovaries grow more and more, and it can make dominant follicle or mature follicle. This mature follicle can secrete estrogen and inhibin. And when the amount of estrogen and inhibin increase by this mature follicle, by negative feedback, the secretion of FSH decline. So we don't have any more growth of primordial and primary follicle. Dizygotic twins or triples result when 2 or 3 secondary follicles become codominant and later are ovulated and fertilized. But normally we have 1 dominant secondary follicle which become mature, which contain to enlarge until it's more than 20 millimeter in its diameter. It's like a blister on the surface of the ovary, and it has a very swollen antrum. During the final maturation process, these mature follicles continue to increase its estrogen production. After that, when the amount of this follicular fluid increase, our follicle rupture, And when we have a rupturing of the follicle, we call it ovulation. And as you see in this picture, the secondary oocyte with the zona pellucida and corona radiata around itself is released in the pelvic cavity. At this time, at the time of ovulation, due to the amount of estrogen, the movement of fimbriae in the beginning of infundibulum increase, and the infundibulum can catch this the secondary oocyte and the corona radiata cell, which is located around it. Sometimes these fimbriae cannot make enough movement, and this secondary oocyte release and it's remain in the pelvic cavity, and after some days it regress. Now this oocyte is released and we have rupturing of the follicle, which make tearing and rupture of some blood capillaries around itself, and the bleeding, as you see here, happen in the follicle. This body is red in its color and we call it corpus hemorrhagicum. Corpus hemorrhagicum remain in the ovary for about 8 hours, and after that this corpus hemorrhagicum, which is consists of granulosa cells and theca cells, change to a yellow body, which we call it corpus luteum. If the oocyte is not fertilized, the corpus luteum has a lifespan of only 2 weeks. Then it degenerates to corpus albicans, as you see here. As the level of progesterone, estrogen, and inhibin quickly decrease, release of GnRH, FSH, and LH rises due to the loss of negative feedback. If the secondary oocyte is fertilized and begin to divide, the corpus luteum persists more than 2 weeks. From the chorion of the embryo, we have release of a hormone, which is HCG, or human chorionic gonadotropin. This hormone is produced, as I told you, by the chorion of the embryo, and beginning about 8 days after fertilization. Like LH, HCG can stimulate the secretory activity of the corpus luteum. The corpus luteum remain in the ovary for about 3 months. It secretes progesterone, and this progesterone can keep pregnancy in the first 3 months. If the amount of progesterone, which is secreted by the corpus luteum, decline, then we have abortion in the first 3 months, or we may have some contraction in the wall of uterus and a spot bleeding take place. For prevention of this spot bleeding, the pregnant women need to have injection of progesterone 3 times a day in the first 3 months. Now, I want to talk about the next cycle, which is the uterine cycle. The uterine cycle, as you see here, has different phases, like the phases which we have in the ovary. The first phase, which we call it menstrual phase, is this. The menstrual flow from the uterus consists of about 50 to 150 milliliter of blood, tissue fluid, mucous and epithelial cells which shed from the endometrium. I hope you remember that we divide our endometrium to a stratum functionalis and a stratum basalis. And as you see in this picture, the stratum functionalis starts to release and release and release. But we have a stratum basalis without any changes. The menstrual flow passes from the uterine cavity through the cervix and vagina to the exterior. After that, we have the other phase, which we call it periovulatory phase. The other name of periovulatory phase in the uterus is proliferative phase. Estrogen, which is secreted by the growing follicle into the blood, can stimulate the repair of endometrium, as you see in this picture. Cells of stratum basalis undergo mitotic division and they produce a new stratum functionalis. As the endometrium become thicker and thicker, endometrial glands develop, arterioles start to coil and become longer, and they penetrate the stratum functionalis, as you see in this picture. The thickness of endometrium become double, and it's about 4 to 10 millimeter in its thickness. And then we have ovulation in the uterus. After ovulation and after production of the corpus luteum, we have a secretion of progesterone. Progesterone and estrogen, which is secreted by the corpus luteum, promote growth of endometrial glands and blood vessels formation and thickening of endometrium to about 12 to 18 millimeter. These changes can peak about 1 week after ovulation, at the time of fertilized ovum might arrive in the uterus. If fertilization doesn't occur, the level of progesterone and estrogen decline due to degeneration of the corpus luteum, and after that, when these hormones decline, again we have menstruation. But if fertilization takes place, then the thickness of endometrium remain like this, and by this endometrial gland we can nourish the fetus in the uterus, and by these blood vessels we can make connection between the fetus and the mother at the site of placenta. Again, in this picture, you can see the ovarian cycle. First, we have primordial follicle, which make primary. After that, we have secondary. This is the mature follicle or vesicular follicle. The pressure of the follicular fluid here increase, and we have rupturing of the Graafian follicle, and ovulation take place. And the remainder of follicle, which is the granulosa cells and theca cells, can make corpus luteum in the ovaries. The corpus luteum can make progesterone. If pregnancy happens, the corpus luteum remain and keep pregnancy for 3 months. If we don't have any fertilization, the corpus luteum degenerates to corpus albicans and new ovarian cycle happen. In this picture, you can see the process of ovulation. Look at the picture. Here you can see the ovary, and this is the Graafian follicle. The Graafian follicle have a large antrum, and this antrum is full of estrogen, and the high level of estrogen which is produced by the mature follicle can stimulate the hypothalamus and also the anterior pituitary gland, and they start to secrete LH, as you see in this picture. The resulting surge of LH can cause the rupture of this mature follicle and expulsion of this secondary oocyte. The secondary oocyte, its corona radiata, is released here, and they are cached by the uterine tube or the oviduct. And you can see the corpus hemorrhagicum, the body which has a small bleeding in the ovary. This corpus hemorrhagicum is like a small cherry on the surface of the ovary. The blood is reabsorbed after 8 hours, and we have corpus luteum after that. We have some cyclical changes in the endometrium in response of ovarian hormone, which I talked about before for you. We have 3 phases. One of them is menstrual phase, day 1 to day 5. We have proliferative or periovulatory phase, which is day 6 to 14. On day 14, we have ovulation, and after that, we have secretory phase or postovulatory phase. In the menstrual phase, ovarian hormones are at their lowest level. Gonadotropin are beginning to rise, and stratum functionalis, as you see in this picture, is shed, and the menstrual flow occurs. In the proliferative phase, as you see here, estrogen level promote generation of the new functional layer and increase synthesis of progesterone receptors on the endometrium. The endometrial gland enlarge and the spiral arteries increase in their number. And after ovulation, we have the next phase, which we call it secretory phase. In the secretory phase, the progesterone level is in the highest. We have further development of endometrium, glandular secretion of glycogen, and formation of the cervical mucous plug. If pregnancy happens, this cervical mucous plug can seal the opening of cervix. It's a part of our immunity, and nothing can come to the uterus and infect the fetus inside the uterus. Again, in this picture, you can see the menstrual phase, the proliferative phase, which the stratum functionalis increase in its thickness, and after that we have secretory phase, which we have many blood vessels and the glands which can secrete a nutrient for the fetus. In this picture, you can see the fluctuation of ovarian hormone. In the first half of the cycle, as you see here, by growing the follicle, the ovarian follicle, the amount of estrogen increase and increase. The highest level of estrogen can promote the secretion of GnRH and LH, and ovulation take place. After ovulation, we have formation of corpus luteum, and the corpus luteum, as you see here, can increase the amount of progesterone in the second half. From the corpus luteum, we have secretion of estrogen too. If fertilization doesn't occur, corpus luteum degenerates, progesterone level falls, spiral arteries start to kink and span, endometrial cells begin to die, spiral arteries constrict again, then relax and become wide. Rush of blood fragments weaken the capillary bed, and the functional layer start to slough off from the surface. The estrogen has different effect in the female. It can promote oogenesis and follicle growth in ovary. It can exert anabolic effect on the female reproductive tract, and it can support the rapid but short-lived growth spurt at the time of puberty. It can induce secondary sexual characteristics like growing of the breast, increased deposit of subcutaneous fat in the hips and breast, widening and lightening of the pelvic cavity, the pelvis, sorry. And it has some metabolic effect. It can help the level of cholesterol to become lower in the female, and we have higher level of HDL in the blood. This is a good cholesterol which we have in the blood, and it can facilitate calcium uptake. So during the reproductive years in the female, we can get enough calcium from our diet, but after that osteoporosis and osteomalacia may take place and happen. And the progesterone works with estrogen to establish and regulate the uterine cycle. It affects the placental progesterone during pregnancy, inhibits the motility of the uterus, and also it can help preparation of the breast for lactation. And the feedback mechanism is very important for regulation of hormones in female reproductive system. The high level of estrogen during the last part of ovulatory phase have a positive feedback effect on cells which can secrete LH and GnRH. so it can make ovulation. There are many hormonal interactions between ovarian and the uterus cycle.